Hi, I'm Jack Cush with RheumNow.com, talking on proceedings from EULAR 2021 being held, supposed to be held in Paris. It's now being held worldwide, virtually everywhere, including where you are right now. I want to talk about highlights in psoriatic arthritis so far from the meeting. A number of very interesting abstracts, two that immediately caught my eye. One presented yesterday about fecal microbiota transplants, FMT, in psoriatic arthritis patients. That's abstract OP0010 or 10. It was a plenary session abstract. It was a very interesting presentation. Obviously, a novel approach. You know, microbiome's been a hot issue. We think that microbiome is a contributory factor in either disease onset or in disease expression. And the question is, if you alter your microbiome, could it work? We do have data in psoriasis and psoriatic arthritis that if you lose weight, you get better. Significantly better by usual measures like ACR20. We do have data, less impressive, about gluten-free and anti-inflammatory diets making psoriatic disease better as well. And so are these issues of weight, leptins and other adipokines contributing to inflammation, or are these issues of microbiome alterations? Well, the microbiome transplant has been used in colitis with great success and several other disorders, and it was studied here. In this study, it was 31 patients, not a large group, 15 of whom got FMT, and don't ask me how they did it. Don't want to go into the details. Nope, not going to do it. Versus placebo. That was easy. Coming up with a placebo for this trial, you know, a bunch of Oreos in a bag, who knows? Anyway, they did the transplants, and it was a 26-week trial, and they had their outcomes, usual outcomes, and quite surprisingly, the microbiota transplant, the fecal microbiota transplant, FMT, was inferior to placebo. Did not work at all. Higher rates of failure with FMT, 60% versus placebo, 15% at 26 weeks. There was no difference in safety. In fact, there was maybe a little less safety issues with the FMT. But it wasn't just the one primary endpoint. It looked like all their primary endpoints or all their secondary endpoints did not do as well with FMT. This was a big surprise. And some of the critique has been maybe what they used and how it was done methodologically was what killed this study. These patients were basically patients who had active disease who stayed on methotrexate but were inadequate responders. So could methotrexate have been something that would have altered the microbiome? And there are some data about methotrexate altering microbiome. So I don't know that this issue is dead. I just know that this was a surprising result. The second study actually hasn't been presented yet, but I've been reading about it. It's called the Junipero study. You may not have seen it, but yesterday, June the 2nd, June the 1st, secukinumab was approved for kids with psoriasis above age 6. And that's for moderate to severe plaque psoriasis that needs systemic therapy. And that's based on, I think, 2 or 3 studies, pretty good outcomes. Nice advantage because you'd like to see the same drugs that are available for adults being used in kids. So there's also one of the trials that were done in kids was this Junipero study. This is going to be presented on Saturday, the 4th. It's called LB, Late Breaking Abstract 0004. It's a study of, I think, 86 kids with either juvenile psoriatic arthritis or ERA, enthesitis-related arthropathy. This was a 2-year study, but it had like a 12-week primary endpoint. And when they looked at how these kids did, both by pediatric or juvenile ACR 30s and ACR 70s, significant improvements over placebo. But nonetheless, this is a nice advantage, a nice new addition for treatment.